Okay, so we were talking about triglycerides, okay, and how they're tied to damaged LDL particles, all right, because we hear so much about cholesterol causing heart disease. Okay, it's just one of the factors involved in it. And when you looked at LDL in general, there's two types of LDL. You have the small one and the big one. The big one doesn't cause any problem. Small one adheres to the artery wall. Well, this is by Dr. William Davis. He's a medical doctor. All right. And he comes out and he continues to say, but the fact remains, while triglycerides may not predict heightened cardiovascular risk independently, the cluster of high triglycerides, low HDL, and small LDL particles is indeed associated with up to a 7-fold increased risk for heart disease. So any increase in triglycerides of 60 milligrams per deciliter or greater suggests that you are forming small LDL particles. So, ladies and gentlemen, one of the best ways to get that down is to cut your carbs down. We hear so much talk about the keto diet, the carnivore diet, the keto diet, the carnivore diet, okay, the low carb diet. I've been doing this way before these guys made it popular. We were doing this stuff back in the 1970s in preparation for competition when I was competing in bodybuilding. We did that to lose body fat. So when you keep your carbs low, insulin drops down and your body uses fat for energy. We're supposed to do that. Did you realize that fat provides 3 to 5 times the amount of cellular energy than carbohydrates do? Yes, fat. But you have to be able to get to the fat. And when you're overproducing insulin, that's difficult to do because insulin locks it away. It doesn't allow the body to use the fat. Doesn't happen. Now we also have to look at cancer. I love this one. More than 2 million Americans will get cancer this year. Here's what you should know. This is although U.S. cancer cases will eclipse 2 million for the first time this year, there's some good news. Lower smoking rates, earlier detection, and improved treatment have lower death rates over the past 3 decades. Says the American Cancer Society annual cancer statistics report projects 611,000, 720,000 cancer deaths this year, a slight increase from a year ago. Officials said people are increasingly being diagnosed in middle age, younger than when diagnosis happened a generation ago, and they are likelier to survive longer. But experts said there are some worrisome signs because Americans' alarming obesity rate and the rising rate of colorectal cancer among young adults. Then we go to this one. If you got blood sugar above 90, you need to pay attention to this because you're pre-diabetic. That's according to Cleveland Clinic as well. And pre-diabetic means you're overproducing insulin to keep your blood sugar under control. Okay? And statin drugs, so you have this information too in front of you, they increase blood sugar. Okay? That's a fact. I'm not making it up. All right. One of the side effects of statin drugs is a progression of diabetes. Okay. Not good. And progression or use of other medications to keep the blood sugar down. Not good. We're not deficient in insulin. It says there's high insulin levels directly linked to pancreatic cancer. They are predicting by 2030, by the way, this will be the number 2 cause of death. Okay. Get this one. A new study from the researchers at the University of British Columbia's Faculty of Medicine reveals a direct link between high insulin levels, common among patients with obesity and type 2 diabetes, and pancreatic cancer. The study, published in Cell Metabolism, provides the first detailed explanation of why people with obesity and type 2 diabetes are at increased risk of pancreatic cancer. The research demonstrates that excessive insulin levels overstimulate pancreatic ancillary cells, which produce digestive juices. The overstimulation leads to inflammation that converts these cells into precancerous cells. Alongside a rapid increase in both obesity and type 2 diabetes, we're seeing an alarming rise in pancreatic cancer rates. Goes on to say, these findings help us understand how this is happening and highlights the importance of keeping insulin levels within a healthy range, which can be accomplished with diet, exercise, and some medications. They said by 2030, pancreatic cancer is expected to become the second leading cause of cancer-related deaths, while obesity and type 2 diabetes have previously been established as risk factors for pancreatic cancer. The exact mechanism of which this is occurred remains unclear. I can tell you what it is. Type 2 diabetics produce 3 to 5 times the level of insulin of non-diabetics. And if you're pre-diabetic, you are producing high levels as well. You're producing enough of it, though, to keep the blood sugar down to a level that they call within that normal range, but still pre-diabetic. You are at increased risk. So if they're talking about this being the second leading cause of cancer, that's alarming. And last time I checked, that's 6 years from now. Pancreatic cancer does not have a good outcome. Extremely painful. Survival is very low. And if you're over-consuming carbohydrates, you're causing a problem. Just like the article I read about triglycerides in whole wheat bread and grains. They cause an increase in blood sugar, glucose. That's from carbohydrates. More than a Snickers bar. So the only one who can control this is you. You have it under control. Or you don't. And that's called diet and exercise. Because when you watch your carbohydrates, your blood sugar stays more under control, and the body doesn't have to overwork overtime to keep it down because it's putting more insulin out to do this. Then insulin is causing the liver to make glycogen, which is storable sugar that's stored in the liver itself primarily, in other organs, small amounts. And then the rest is converted into triglycerides and stored as fat. So when you keep insulin down, you burn fat for fuel. You're not making new fat. And insulin also is an irritant. It causes inflammation. And if you're a pre-diabetic or diabetic, you're constantly in a chronic state of inflammation. Take anybody who goes on a good low-carb diet. They will tell you that they don't have the same inflammation issues, achy joints, teeth that ache, pain, fatigue. And then they take a break and they splurge and they feel like you know what. It shows the power of food. Unfortunately, many of us don't have self-control to do this, so we need to have help. And that's the primary driving force that I had back in the 30 years ago when I formed my business. And started working with people in my age group to help them have a healthier lifestyle.